Assalamualaikum and a very good morning. Today I would like to talk and tell you on a topic anxiety. Anxiety disorder have been recognized as a type of mental health conditions. If you have an anxiety disorder, you may respond to certain things and situations with fears and dread. You may also experience physical signs of anxiety, such as a pounding heart and sweating. Anxiety is a common condition experienced by all human beings at some point in their life. A person can feel anxious when they are faced with a stressful situation or is about to face a new and exciting condition. My anxiety is not only normal, but it can be useful by motivating the individual experiencing it to become more alert and focused when facing an important situations. And anxiety can even be beneficial. For example, anxiety helps us notice dangerous situations and focus our intentions so we are stay safe. But an anxiety disorder goes beyond the regular nervousness and slightly fears you may feel from time to time. An anxiety disorder happens when anxiety interferes with your ability to function. You often overreact when something triggers your emotions. You can't control your responses to situations. From that, there's a few levels of anxiety symptoms among society from survey of study. Anxiety disorder can make it difficult to get through the day. Fortunately, there are several causes and effective treatment for anxiety disorder. Proceed to causes of anxiety. Anxiety have no known cause, but there are a number of risk factors for the disorder have been identified. One risk factor is genetic makeup of a person. The biological part in causing anxiety disorder, since some people have a genetic predispositions to developing this disorder. If there is a history of anxiety disorder in the family, a person have a great susceptibility toward anxiety. Anxiety disorder in adults can be caused by emotional or physical abuse experienced during childhood. Research indicates that anxiety disorders such as social anxiety disorder (SAD) and panic disorder (PD) in adults may be caused by certain forms of childhood abuse suffered by individuals. Individuals who have traumatic childhood experience such as familial violence, parents' marital problem, parents' separations or divorce, and sexual abuse in the family are more likely to develop this disorder. While both physical abuse and emotional abuse are predictive to the development of anxiety disorder, emotional abusive are more damaging. Childhood emotional abuse such as excessive bullying, teasing, and ridicule is more associated with anxiety disorder than the physical or social abuse. Neglect in childhood also contribute to the development of anxiety disorder in adults. Stressful life event can also lead to the development of anxiety disorder. These events are diverse in nature and they may include death of family member or a loved one, poor health condition, accident or interpersonal and family issues. The event lead to the development of anxiety disorder when the individual adopt poor coping mechanism to the event. From the graph show, according to a survey on mental health and wellness conducted by a Rakuten Insight in Malaysia in May 2022, as you can see, the highest number of people suffering from stress or anxiety come from adults from age 18 to 24 years old and followed by age 25 to 34 years old. Why and how it happened? In the study, most of 18 to 24 years old respondents were college or university students. Several populations were based survey have also revealed that students report a higher prevalence of depressive anxiety and stress symptoms. Study on student population throughout the Malaysia, including Malaysia, have shown that COVID-19 pandemic have put a strain of their mental health. The main reason of students experience heightened psychological distress, including academic effect, changes in academic activity, difficulty adapting to online distance learning method, and uncertainty about the future with regard to academic and career. Given the unpredictable COVID-19 crisis and uncertainty with regard to how long school will remain closed, the findings suggest the importance of closely monitoring student mental health status and providing physiological counseling or mental health service. School and health authorities should work together to deliver prompt psychological support to affected students. The relationship between stressful life event and anxiety disorder is that this event create new worry, leading to the implementation of poor coping strategy that result in excessive anxiety. Use of drug and substance abuse can result in a development of anxiety disorder. From other research found excessive caffeine use or withdrawal might lead to the development of significant anxiety symptoms. Next, many people underestimate the seriousness of anxiety disorders. Anxiety is deemed a normal condition. However, anxiety disorder can lead to many adverse effects on the person suffering from the conditions and the society. It is therefore crucial to look for ways to treat this disorder and mitigate and several consequences associated with them. Anxiety disorder can be treated by use a medication prescribed by a physician. Appropriate detection of anxiety disorder is necessary if the individual is to be given the appropriate treatment. The type of anxiety disorder afflicting an individual will influence the choice of treatment used by the doctor. Most physicians make use of medication to reduce symptoms and medicate the major adverse effect of anxiety disorder. The anti-anxiety medication offer help by reducing the anxiety or dealing with the physical symptoms that bring about anxiety. Proper medication enables the person to lead a normal life and avoid the disabling impact of this disorder. Most of the medication prescribed are aimed at reducing the emotional sensitivity to stress and the avoidance behavior related to specific situations. Another form of treatment is psychotherapy, and it is offered by psychiatrists. Through this treatment, the patient talk with the mental health professional and it proven help them. The harmful coping methods used by the patients are also identified during these sessions. With this information, the trained mental health professionals are able to assist the patient to come up with ways to deal with the conditions. Unlike medication, which do not cure the disorder, effective psychotherapy will lead to a complete curing. In addition to medications and psychotherapy, proper dieting and exercise can be used to offset some anxiety. Exercise assists by increasing personal confidence in individual. Exercise also lead to be a sense of well-being, which reduce depressions and lead to less anxiety. Over the past decade, there has been increased awareness about anxiety disorder by healthcare professionals. This awareness has led to a desire to improve the quality of life for patients through medical interventions. More treatment for anxiety disorder are being discovered as greater research is done on the topic. If anxiety disorders are left untreated, they might lead to the development of other mental disorders such as depression in the patient, therefore future decreasing their quality of life. In conclusions, there are several causes and effective treatment for anxiety disorder. I also would like to recommend people who have symptoms of anxiety to get help and seek professional, because prevent better than cure. That's all from me. Thank you.